Class 1. NCLEX-RN. Ethical and Legal Principles, Management. Ethical Principles. Autonomy, right to be informed and self-determination. Beneficence, duty to do good, to prevent and remove harm. Non-maleficence, duty of not doing bad. Do not harm, intentionally or not intentionally. Justice, equitable distribution of resources and benefits, fairness. Veracity, obligation to tell the complete truth. Fidelity, the duty to do what one has promised. Hospital Ethics Committee. Life Support. Pregnant Woman vs. Fetus Lives Issues. Reproductive Issues and Genetic Counseling, Huntington's. Religious Cultural Issues. In which of the following scenarios the nurse anticipates should intervene the Hospital Ethic Committee? A. Client terminally ill who wants to donor organs and family refuse. B. Client with metastatic ovarian cancer refuses chemotherapy recommended by oncologist. C. Woman in treatment for sterility conceived 6 embryos and wants 4 to be removed. D. Client is requesting to be DNR and spouse refuses. Legal issues. State Nurse Practice Act. Legal fundaments. Scope of practice. Licensing. Malpractice, negligence on nursing practice, non-intentional. Requirements to have a case. Duty, breach of duty, damage. Atropine in glaucoma. Rubbing the abdomen of a child with a Wilms tumor. Oxytocin in late decelerations. Good Samaritan law. Out-of-hospital emergencies. No gross negligence. No abandonment. No compensation. Documentation, factual and detailed. A child with a fractured femur is brought to the emergency room by the parents. The parents state the child fell off the sofa. On examination, the nurse finds several blistered areas on the child's buttocks. Which is the appropriately form? The nurse should document these findings. 6 areas of 1 centimeter diameter reddened, moist blistered areas noted on buttocks. Multiple small burn marks noted on buttocks due to child abuse. Blistered and reddened skin noted on buttocks due to unknown causes. Several areas that appear to be cigarette burns noted on buttocks. Correcting errors, draw a line, enter the correct information, initial and date. Late entries, don't leave any blank space between documentation. Intentional torts. Assault. Threat of harmful or offensive contact. Battery. Intentional touching without others' consent. False imprisonment. Client is not allowed to leave facility. Unauthorized restraining. Defamation. Damages to reputation. Verbal, slander. Written, libel. Informed consent, self-determination. Requirements. Adulthood and mental competence. Informed. Voluntary. Information given by the provider, consent obtained by the provider. Nurse, give document to sign and witnesses the client's voluntary signature. Incompetent to give consent. Under sedation, drugs or alcohol, uncompensated psychosis. Minors, 18 years old, except. Emancipated minors, married, court-designated, military. Non-emancipated mature minors, STDs, substance abuse, prenatal care, and contraceptive prescription. Consent can be waived in emergencies if it can't be obtained. Consent should be given by client or by authorized proxy. Consent can be rescinded by competent client at any moment. Advanced Directives, Self-Determination Act. Living will for health care. List treatment that client chooses or refuse if becomes unable to make decisions and is terminally ill. Does not include financial decisions. Durable power of attorney. Patient appoints healthcare proxy to carry out client's wishes. Take decisions that are not already documented on living will. The client speaks through the proxy. Do not resuscitate, DNR, prescription. Physician's written prescription. Limited only to CPR. Order renewed at each admission. Not abiding known DNR order, battery. Restrains. Nursing implications. Least restrictive restraint if all other measures were ineffective. No PRN restraint orders. Renewed every 24 hours. Assess and document neurovascular and skin status every 15-30. Remove restraints at least every 2 hours, toileting, fluids, food, skin check. Half-bow safety not tied to bed frame, not to side rails. Managed care and case management. Managed care. Appropriate client care and satisfaction. Control costs. Continuity of care. Reserved for complex chronic cases. Critical pathway, specific outcomes within a time frame. Variance is a deviation from a critical pathway, loss of reimbursement. Evidence-based practice. It is a problem-solving approach integrating the most relevant research literature, the nurse one's clinical expertise, patient preferences and values. Example: pH for NG tube placement, prophylactic antibiotics, hand washing. RN. Assessment, diagnosis, care plan, teaching, evaluations, consultations. Admissions, transfers, and discharges. Central catheters, for push, blood transfusions, chemo, for anticoagulants. Unstable patients, just received from, newly diagnosed. LPN. Administration of oral, IM, SQ, topical medications. Maintain/regulate for, non-for push medications. NG or PEG tubes medication/feeding. Insertion of Foleys. Tracheotomy care. Tract ions and wound care. Ongoing assessment of low-risk/chronic patients. UAP, CNA. ADLs, feeding, no dysphagia, vital signs, urinary output, recording I&O, ambulation of stable patients, skin barrier, tap water enemas, CPR. Leadership, delegation. RN can delegate interventions in the scope of LPNs and UAPs. Only interventions can be delegated. LPN can do ongoing assessment initiated by RN. E.g. breath and bowel sounds, neurovascular checks. LPN and UAP can reinforce some teachings initiated by RN. Prioritization, ABCD alterations. Airway. Stridor, epiglottitis, anaphylaxis. Face burns. Dislodged tracheotomy. Dysphagia. Breathing. Respiratory center depression, opioids, Mg sulfate, benzodiazepines. Cervical spine lesions. Muscles weakness, M. gravis, G. bar. Chest trauma, pneumothorax, flail chest. Pulmonary edema. Chest tube and ventilator dysfunction. Circulation. Chest pain. Ventricular arrhythmias, potassium, Ca and Mg, digoxin, thyroid, hypotension, shock, bleeding, dehydration. Immediate postoperative and post-procedures, cath lab, clients. Summarizing, who needs to be seen first? Acute vs. Chronic. Actual problem vs. Potential problem. Unexpected vs. Expected. Triage in emergency nursing. Red, emergent, airway, breathing, chest pain, bleeding, head trauma, neck, chest, and abdomen wounds. Yellow, urgent, fractures, dislocations, flesh wounds, fever. Green, non-urgent, minor lacerations, sprains, abrasions, rashes. Black, without probabilities or dead. Only pain medication until death.